Each year, more than 435,000 Americans undergo joint replacement surgery for a new hip or knee. A new technique in joint replacement has revolutionized how this surgery is being performed. We spoke with Dr. Alan Beyer of Hoag Memorial Hospital Presbyterian in Newport Beach. He discusses patient-specific joint replacement.
Patient-specific joint replacement is a relatively new technique which has been developed by the ability of an X-ray or MRI scan or CT image of a knee, for instance, to be digitized. And then that digital image can be used to make instruments that specifically fit one person's knee, so the operation can be done with instrumentation that is made specifically for their anatomy. It's kind of like the third version, the third iteration of what started out as computer navigation that we used to use a couple of years ago to get perfect alignment of our knee components when we put them in. That was followed by robotic surgery, which is still currently being done a fair amount, where a robotic device is actually used to help the surgeon make his cuts perfectly for fitting components into place, until finally, through CAD/CAM engineering, where specific instruments could be made off of a computer-generated image, we are now basically shipped a little box of instruments that are specifically designed to fit the patient who's having the surgery that day, which will absolutely ensure that the patient's components are put in absolutely perfectly aligned. The reason why we strive for this perfect alignment is because most of the long-term studies in knee replacement show that the difference between a total knee replacement that lasts, say, 5 years versus a total knee replacement that lasts 20 years is one that's put in perfectly aligned. It's very, very difficult to perfectly align things when you're using your eyeball and just some regular instruments that you're fitting into place onto a person's anatomy, because everybody's anatomy is different.
Dr. Beyer describes the complete process of this patient-specific surgery.
Initially, the patient will be seen in the office and indicated for a knee replacement. They have the x-rays and the physical exam and history that are consistent with the degenerative disease of the knee that requires knee replacement. At that point, if the surgeon decides that this patient is a good candidate for patient-specific instrumentation, we'll order an MRI scan or a CT scan on that patient, depending on which equipment manufacturer's prosthesis we're using. And then that scan will be sent to the manufacturer. They will then custom create those instruments off of the MRI scan or CT scan. The day before the patient's surgery, they'll be shipped back to the hospital, so they're sitting in the operating room when we're there with the patient and ready to use. Now, as far as the actual procedure, the approach to the knee is very, very similar to what we do with traditional instrumentation, perhaps a little bit smaller because you don't need quite as much exposure when the instruments fit the person perfectly.
Dr. Beyer recommends this kind of surgery for certain patients.
At the current time, we're using these types of specific instruments for patients who have a more difficult challenge in terms of getting a knee replacement into them because of various other parts of their particular process, i.e. patients who have previous hardware from a previous operation that would make it difficult to use computer navigation or some of our traditional tools, or people who have a knee that's very, very degenerative and very deformed, where it would be very, very difficult to do a traditional total knee replacement with a high degree of accuracy. And like anything new, you need to go through that learning curve. I think that if we come back and revisit this in 3 to 4 years or so, we're going to say that this is one of the ones that was a winner, that made it. I'm not willing to totally embrace something like this and throw it all in and say 100% of my patients are getting this until I'm a little bit more convinced that this is really the right way to go for the future. I think we're going to see the long-term benefits from patient-specific instrumentation in the 10 to 15 to 20-year follow-ups, when we see the ones that are really lasting much longer because we were able to put them in with a greater degree of precision. I think in the short term, it's really not going to be a very, very big difference from traditional knee replacement. Now, one thing that you asked that I need to address is that the decision to use a patient-specific instrumentation really is still pretty much the surgeon's decision based on what that particular patient's parameters are. It's not something where a patient comes in and says, I want a patient-specific knee. We're still a little bit too early in the course of things to be offering it in that kind of circumstance. I think it's still something that's up to the surgeon to decide when and if he wants to use it.